Assalamu alaikum. I am Professor Dr. M Iqbal Afridi, the Dean of the College of Physician and Surgeon of Pakistan, as well as the meritorious professor, and I'm also the fellow of the College of Physician and Surgeon and the Royal College of Ireland and Royal College of Edinburgh. And I'm also the editor-in-chief of the Journal of Pakistan Psychiatric Society. We will talk about depression. Depression is a common condition that is characterized by persistent sadness of mood along with decreased energy and lack of interest. Although this is an emotional disorder, but it does not spare other area of brain and other faculties of mind. Especially I'll talk about the cognitive function. Cognitive function is one of the area which is badly affected by the depressive disorder. This can lead to many complications in the form of bad performance at school or at the organization where the person is working, and this can also have an enormous implication if the person is working on the banking or other digital system. For example, if he has to shift some transfer money, he can have a lot of error leading to a lot of damage to the economy. So therefore we should focus, apart from the treatment, that the person should have balanced lifestyle in the form of a good ratio between sleep, exercise, diet, and especially diet means those substances which contain tyramine, and because this tyramine is a precursor of serotonin, which is usually disturbed. And also the person should have improve his cognition and his thinking, his behavior, as his emotion, and this can be done with the help of psychologists in the form of cognitive behavioral therapy, as well as the person should be a working person, because work is worship, work is therapy. And when the treatment is needed in the form of pharmacotherapy, now we have wonderful drugs, especially the SSRI and the novel antidepressant, which also addresses the disturbance of cognition, and this can lead to very good remission as well as good performance in the form of improving the memory, attention, concentration, judgment. In other words, cognitive functions can lead to very good things, and these luckily this medicine can also have good impact on the sexual function, as well as it does not lead to obesity. So therefore now luckily we have wide range of medication available for the depressive disorder. And let's talk about depression, and also let us treat it by all means and by all levels. If we talk about the causes of depressive disorder, it can be divided into biological, psychological, and social. Biological, there is vulnerability. About 40% of the vulnerability is due to family history, due to genetics, and also if there is disturbance in the neurotransmitter, especially serotonin, norepinephrine, and dopamine, and nowadays we can call BDNF, that is brain derived neurotrophic factor. And psychologically, if we do not encourage our kids and also if they are not given adequate opportunity to play and also to enjoy and to ask questions, so this can also lead to psychologically lead to depressive disorder. And there is social reason, for example, lack of employment, and in developing countries law and order situation, and continuous failures. So therefore, and bullying is one of the cause that lead to depressive and anxiety disorder. So if we want to prevent, we have to act on the biological, psychological, and social according to the biopsychosocial model. And the complication of the depressive disorder are huge. It is really a fatal condition. About 15% of the patients commit suicide, and more than that can just attempt suicide. So therefore Another complication can be in the form of if the person is a driver and he is depressed, and due to lack of concentration and attention and cognitive disturbance, he may miss the red light and hit the car, and leading to death not only for himself but for others. Similarly, if a woman who is depressed and she is working in the kitchen, she can burn herself. So therefore, we should identify, treat and defeat disease by all means and by all levels. Thank you.